Today, we are taking a look at Erythema multiforme. This is the outline of the talk today. Introduction, etiology, clinical manifestation, cause, investigations, and treatment. Erythema multiforme is a reaction pattern of blood vessels in the dermis with secondary epidermal changes. These present as erythematous target or iris lesions, which are papules or vesiculobullous lesions. Common sites affected are the extremities, especially the palms and soles, as well as the mucous membranes. The cause is usually benign, but patients can have frequent recurrences needing long-term anti-HSV or herpes simplex medication. In erythema multiforme major, it is a more severe cause. Half of the patients with erythema multiforme are less than 20 years old, and it is more common in males. In terms of etiology, infection such as herpes simplex virus, HSV, or mycoplasma. Drugs such as sulfonamides, phenytoin, barbiturates, phenylbutazone, penicillin, and allopurinol, as well as idiopathic cases. In terms of history, ask about prior episodes, the presence of pruritus or pain, evolution over roughly around 10 days, and in severe disease, patients can have fever, weakness, and malaise. For the skin lesions, you first have a macule progressing to a papule measuring around 1 to 2 centimeters, and then further developing vesicles and bullae in the center. The lesions are dull red, and they are known as iris or target lesions because there are 3 zones. First, you have a darker area or blister in the center, followed by a pale zone, and then a darker red outer ring. Sites can be localized or generalized, but are typically bilateral and symmetric. And common areas affected are the hands, such as the dorsum of the hands, palms, soles, forearms, feet, face, elbows, knees, and genitals. So this is the picture of a target lesion, and you can appreciate the 3 zones. Mucous membranes can have erosions with fibrin membranes and occasionally ulcerations. Sites involved include the lips, oropharynx, nasal, conjunctival, vulvar, as well as anal regions. Eyes can be affected with corneal ulcers and anterior uveitis. For erythema multiforme minor or the mild form, there is little or no mucous membrane involvement, vesicles, no systemic symptoms, and it is localized to the extremities or face, as well as the presence of target lesions, while recurrent EM minor is associated with preceding HSV. On the other hand, for EM major, this is often due to a drug reaction, and the patients have mucous membrane and eye involvement. Severe and extensive disease can become confluent as well as bullous, and there is the presence of a positive Bukowski sign. Systemic symptoms can be present such as fever and weakness. Investigation is skin biopsy. In terms of treatment, for itch, you can offer oral antihistamines and topical steroids. For pain, oral antiseptic or local anesthetic washes for mild mucosal involvement. In severe disease, patients may require systemic glucocorticoids. And for the prevention of recurrent EM, you can consider oral acyclovir, valacyclovir, or famciclovir. So you need to be able to identify the target lesions in erythema multiforme and often think about HSV or drug reactions as the causes of the erythema multiforme and know the difference between EM minor and EM major. And with that, thank you very much for your kind attention and have a nice day. See you again soon.